AMA Medical Manufacturing says it is expanding and advancing its offerings with new partnerships as it seeks to catalyze the production of anti-venoms here in Nigeria, bringing public health solutions to the last mile as it also looks to serve the wider African market. Hello there and welcome to this Memorandum of Understanding signing ceremony between AMA Medical Manufacturing as well as MicroPharm and Echitab Study Group Nigeria. I'm David Alabi. Welcome to the show. The last time we were here at this facility was earlier in March this year to mark the commencement of the construction of the OSD plant here in Kudenda, which is an extension of this current facility, marking the phase 2 of this edifice here. Today now, the conversation centers around how the country can scale its offerings, attending to the issues around anti-snake venom. The deal signing session covers knowledge and technology transfer as well as financing commitments, a move driven by the need to drive down the cost of snake anti-venom, especially in endemic communities.
So this will definitely, tell the world that yes, AMA is serious. They did the groundbreaking for, the phase 2, and that phase 2 is already starting, with this. Signing of MoU. And also, we are having the first full involvement of private sector into this anti-venom manufacturing. Everything was done before through the public sector here in Nigeria. And also, this signing of the MoU will now provide the assurance that at any given time there will be a anti-snake venom available in Nigeria. After this event here, we are going to Abuja to meet with the coordinating Minister of Health and some chief executive officers of the NHI, that's National Health Insurance Agency, National Primary Health Care Development Agency, and the chief executive of the agency that is going to unlock the industrial sector of medical service. So with this, we should be able to guarantee also the funding, the procurement aspect. And we think if we get that done and the government, federal government, supports this venture through advanced procurement system, then the industry will survive, that we can even export to other countries.
Well, I think it's important to remember that it was the Nigerian Federal Ministry of Health that started the Echitab project, 20-odd years ago, and we're looking for the present government to continue that commitment. The only reason there's a shortage of anti-venom in Nigeria at the moment is the lack of funding. We can manufacture more product, but equally, unfortunately, we're not big enough to be philanthropic. So we do require, an ability that the customer does pay. And a rural farmer on $2 a day cannot afford an anti-venom. So the involvement of the state in funding anti-venom free at the point of use would transform the healthcare of the rural poor who are afflicted by snakebite.
It's a great advantage to have the technological transfer here, because not only do we use the technology acquirement in the development of anti-snake venom, but there are other biologicals that may use the same technique, the same knowledge to develop. He mentioned it, the Echitab MicroPharm officials had mentioned that there are some other useful biologicals, and in the course of that, it gives training to Nigerians. It gives opportunity to Nigerians, apart from the main advantage of making anti-snake venom available at all time to Nigerians.
Now, Prof, let's talk about timelines for the deliverables here across board.
We are giving ourselves a maximum of 6 months for us to at least commence, part of the manufacturing. We phased it, starting with filling and packaging. Then subsequently we do bulk, and then we do, full, production. That will take up to maybe 2-3 years.
It's difficult to put an exact number at the moment, but certainly an investment required of several $1 million to construct a manufacturing facility in Kaduna. In addition to that, it's probably a 3-year project to transfer the manufacturing know-how. It would require staff from MicroPharm to come to Kaduna to train, and equally staff from Kaduna AMA to come to MicroPharm to see the products and how we make it at the present time. So the equipment is probably the easy bit. It's the know-how, the quality, the training that always takes time, and there's a big investment in terms of time, and time is money.
The next line of conversation touches on efficacy, regulatory approvals, and value addition, as this introduces new tweaks to near-term expansion plans to accommodate a new production line.
Well, MicroPharm is working on other products based on the same technology for the treatment of Clostridium difficile infection. We've also developed products for different plant poisonings like colchicine and ricin. So there are other products, and really it's that we've got to get the anti-venom side set up. I think it's important that we want the quality of the product produced by AMA to be the same quality that we produce in Wales. That's key for the future. I think having safe and effective anti-venoms will ensure that AMA's brand name is protected.
You see, the production of Echitab Plus, that is, it involves neutrality of the neutralization of 3 anti-venoms. The puff, again, is effective against puff adder, carpet viper, and cobra. But there's one important anti-venom, venom that has not been put into practice yet, has not been challenged. That is mambas. And definitely, with the good work that AMA is doing, maybe the subsequent long-term effect is to produce the anti-venom against also the mambas that are found in the southern part of Nigeria, mainly.
As soon as Echitab, sailed through all regulatory requirements and got registered by NAFDAC, many African countries started asking, as I'm talking to you now, some other African countries are already asking how they can gain access to Echitab. So the market is there. We must exploit the opportunity to hit that market. On the radar, the short term is to make sure that this phase 1 is functional, all the products are in the market, to get all the necessary approvals by NAFDAC for the products. That is done, where our dossier has been uploaded, and we are waiting just the next go ahead, which should not take more than 2-3 weeks. So that will be achieved. More large volume manufacturing facilities are being imported, and also feel that we shall conclude that phase 1 and move into the medium term. The medium term is now create this small volume manufacturing system within the clinical GMP, good manufacturing practice facility we already have, and then leverage on it, and to work with MicroPharm UK and start getting the product. So you will soon see an anti-venom manufactured by AMA in collaboration with MicroPharm.
A chat with the Chief Executive Officer of AMA Investment and Infrastructure Holdings provides insights into talks with other development partners as the group focuses on achieving medical industrialization here in Nigeria and de-risking the investment landscape.
So we are discussing with AfriExim. The discussion is at the highest level. I had a meeting with the president of AfriExim like 2 weeks ago in Geneva, and it's looking positive. And we're also talking to Bank of Industry, BOI. They've been here, they know what we are doing, and they are showing willingness to partner with us to help us to proceed with this project that we've undertaken to to do here in Kaduna. The same challenge we have in Nigeria is the same challenge they have all over Africa. So when we do something in Nigeria and we do it right, the African market is there for the taking. The only country that is trying to be ahead of us is Kenya, University of Nairobi. But with this MoU, I believe we're a step ahead of them. And so the African market is huge. It's over 1 billion people. And snakebite is not only in Nigeria, it's all over Africa. So I believe the sky is the limit. And I see endless possibility, especially with our partnership with MicroPharm. It's not only anti-venom they are doing, there are other things they are doing, but let's finish this first, one thing at a time. The OCD you mentioned earlier, that is behind us. We've signed contract already with the equipment manufacturers. We've signed contract with the builders. I'm sure when you come back here in the next 2 months, you'll see the buildings will start going.
Yes. The management of AMA Medical Manufacturing says it is committed to driving innovations within the pharmaceutical space and also bring public healthcare services to the last mile. Well, it's time to draw the curtain on this Memorandum of Understanding signing ceremony between AMA Medical Manufacturing and that of MicroPharm, as well as Echitab, a startup group Nigeria. From the industrial layout here in Kudenda, it's bye from me, David Alabi, and thanks for watching.